My name is Adriene Kinnaird, and I'm the Vice President of Oncology Services for the St. Louis region. I wanted to thank everyone for allowing me to come here today to talk about something that I really love. And if you allow me, I want to tell you a story, the story that will answer the question, why? Why do we help? It was 1985 when I met Barbara. She was 21 years old and very attractive. Barbara appeared to be like any other 21-year-old. She looked no different. She was full of life, she was adventurous, and she was ready to conquer the world. However, there was something very different about her. As a baby, she had a Wilms tumor, which is typically found in children, and it's a rare kidney cancer. And now she was faced with bilateral breast cancer, and I was her radiation therapist. Over the next few years, Barbara and she became more than just a patient. She was a friend. She actually became my best friend. I treated her breast, her arm, her hip, and her brain. And as her friend, I wanted to say, please stop moving. Just stop. But the disease just kept moving. No matter what happened, Barbara remained enthusiastic with a survivor's mentality. I'm going to live the best life I can, she would say to me. She came in each day dressed beautifully with her 3-inch heels. She would limp in, and I would say, Barbara, take off those heels. And she would say to me, Adriene, if I look good, I feel better. And what am I to say to something like that? So I just let Barbara wear her heels. On March 6, 1990, Barbara was admitted to the hospital. And I would never forget it because it was 3 days before my birthday. And we had really big plans. I visited her every day. However, this time it was something a little different. Instead of us discussing what we were going to do when she got out of the hospital, she decided she was going to tell me what she wanted me to do. I remember it as though it was yesterday. She became progressively incoherent. But before she slipped away, I made a promise. And my promise to her was that I would take care of those that are in need. It didn't matter what it was. And that I would always work with cancer patients. She passed away a few days later on March 13th, 1990. So I honor our friendship I have done the best thing to keep my word to her by working in oncology now for over 30 years. I teach sewing to those who can't afford to buy clothes. I donate sewing machines to those families as well, and at least 5 to 6 families per year. I also mentor young ladies and sit on several oncology-specific boards. On a regular basis, I remind myself of the promise I made to Barbara. I use it to motivate myself to live the mission of SSM Health. Recently, I was made aware of a friend's daughter who had a less than satisfactory experience in one of our medical oncology offices. My friend told me that Tracy was 35 and was diagnosed with stage 4 colon cancer with a prognosis of less than 5 years. I called Tracy immediately, and for 30 minutes, she spoke, and I listened. She told me about the day of her diagnosis and about how her doctor's words had offered a mixture of blunt honesty and misplaced lightheartedness that didn't align with her individual needs. Tracy made it clear she was going to transfer her care from SSM, which was after her surgery, which was scheduled the very next day. I asked her, Do you mind if I come to visit you and meet you? She said yes. So I stopped by her room the day after her surgery. The evening of her surgery, I went to visit her at SSM DePaul Hospital. We talked for almost 2 hours. We talked about her hopes for the future, and we discovered we were members of the same sorority. At the end of the visit, I asked her if she'd mind if she would allow me to find her another physician within SSM, and she agreed. I shared her concerns. That evening, the nurse practitioner, as well as the physician, went by her room to visit her. Tracy began with the new oncologist, and with his help, she was able to come to terms with the seriousness of her condition. Much like Barbara, Tracy began to focus on living within the joy of the moment. She recently completed her first course of chemotherapy, and with that, help of the doctor had opted to stop and to look at other alternatives moving forward that would allow her to enjoy her life more than she was able to while she was receiving her chemotherapy. Tracy's unexpected diagnosis prompted her sister to be screened, and unfortunately, the screening revealed that her sister also had colon cancer. But Tracy encouraged her sister to come to SSM Health for treatment and is now doing well. Tracy and I speak on a regular basis. Instead of talking about her cancer, we talk about things like the things she missed, like a salad, something that she didn't enjoy while she was having her chemotherapy, like traveling and like teaching children. Instead of focusing on her illness, we talk about many things she would like to accomplish and about her desire to pay it forward. She has decided to live her life to the fullest. Her prognosis hasn't changed, but her outlook has. Each day, I wake up and I thank God for allowing me to continue to serve. What we do is hard and it's demanding, but we, SSM Health, should always do what I ask my team. One is to speak in the affirmative, be courageous, and be kind. We owe it to our patients and each other, and I owe it to Barbara. So thank you very much.